So now we will talk about altitude related disorders. So there are basically three altitude related disorders: acute mountain sickness, high altitude pulmonary edema, high altitude cerebral edema. Acute mountain sickness is basically at lower altitude where someone can feel some symptoms of headache, fatigue, nausea, and usually acute mountain sickness is self-limiting. It starts from 6 to 12 hours if someone is at the altitude below 3000 meter, and it can last for few days. As we discussed, fatigue, nausea, headache. Fatigue is the most important. If you see someone is going for hiking on the mountains and they are experiencing fatigue, we are talking about acute mountain sickness. Management: person has to come down. Medication: acetazolamide. How it will work, you don't need to go into detail. Respiratory alkalosis causing increased respiratory rate, we don't need to remember this. Acetazolamide, and make sure to not gain altitude more than 500 meter a day. Acute mountain sickness is done. How the MCQs will come? So someone 40-year male, around 4000 meter hiking expedition, report extreme fatigue, headache, normal examination. What is the management? Acetazolamide. Same, a different MCQ. Someone is going up Mount Kilimanjaro, 3600 meter, experiencing fatigue but no pulmonary edema or cerebral edema. What is the management? Acetazolamide. Now, if we increase the altitude, that acute mountain sickness can become and cause high altitude pulmonary edema or high altitude cerebral edema. So let's talk about high altitude pulmonary edema. What will happen? We all know on high altitude there is hypobaric hypoxia, which will cause uneven hypoxic pulmonary vasoconstriction. Hypoxia causing uneven vasoconstriction. Uneven vasoconstriction will cause low blood flow in some areas and high blood flow in other areas of lung. That high blood flow will cause more pressure and leakage into alveoli. So this is the first mechanism by which there will be fluid in the alveoli and it will cause pulmonary edema. The other mechanism is that hypoxia from the first condition, hypoxia itself can increase capillary permeability, which will cause further leakage into the alveoli. So this is HAPE, HAPE, high altitude pulmonary edema. Management: calm down, need oxygen, nifedipine, dexamethasone, acetazolamide, phosphodiesterase type 5 inhibitor. For MRCP, remember this: nifedipine. Nifedipine for pulmonary edema, high altitude related issue. MCQ: someone is going up Mount Kilimanjaro, so we can see the altitude is 4500 meter. So if we are talking about acute mountain sickness, fatigue, 3000-ish altitude, acetazolamide. So altitude is more, someone is going up and we notice some frothy pink uh, substance, cough, expiratory, on examination, bilateral basal crackles. What is the management? Nifedipine. We can give dexamethasone, but that is mostly for high altitude cerebral edema. In contrast to HAPE, cerebral vasodilation is the issue. In this, we discussed uneven vasoconstriction will cause low blood flow and high blood flow, and that high blood flow will cause more pressure and leakage. Here, the dilation will cause, the hypoxia will cause cerebral vasodilation, which will increase cerebral blood flow and volume, which will cause all the cerebellar signs or cerebral symptoms. The other thing, hypoxia can cause increased permeability, and this brain capillaries will become more leaky. So the second bit is same as this: hypoxia causing increased capillary permeability, hypoxia causing increased permeability and causing leakage. Management: descent and dexamethasone. Looking at the MCQ, someone is hiking on Mount Everest, 5700 meter, headache, loss of coordination, and slurred speech. What is the management? Dexamethasone and descent. So, just to quickly summarize, if someone is having difficulty breathing and they are around 4 to 5000 meter, and on chest examination we see some crackles, we are talking about, hey, we need to give nifedipine. If there is nothing mentioned about crackles or difficulty breathing and it is slurred speech, coordination, numbness, tingling, we are talking about cerebral edema, and we need to give dexamethasone. For acute mountain sickness, the word will be fatigue. So this is altitude related disorders. So we will move on to next now.